All right, today we're diving deep into a solution for severe erectile dysfunction that's often considered the final frontier, the penile prosthesis. For a lot of men, this is the most effective option when pretty much everything else has been tried. So let's get right into it.
This isn't just some abstract question for millions of guys out there. Maybe you've tried the pills, maybe you've moved on to injections, but for whatever reason, they just aren't cutting it anymore. So what's next? Where do you go from there? Well, that's exactly what we're going to unpack.
So first things first, let's be really clear about when this comes into the picture. A penile prosthesis is not a starting point. It's a very, very effective option, but it's really for when other treatments just haven't delivered the results you're looking for.
Exactly. We're talking about a procedure for patients who've already gone down the road with other therapies and they just didn't work out. But this isn't about giving up. It's really about taking control and finding a permanent solution that actually works for you and your life.
And what's really interesting here is just how broad the range of candidates is. Of course, it includes men whose other therapies have failed. But it's also a fantastic solution for specific conditions, like advanced Peyronie's disease, which causes that painful curvature, or for guys who've had serious physical trauma. But what's crucial to see here is that last point. It can also just be a patient's personal, informed choice after weighing all the pros and cons.
Okay, so we've covered the why, so now let's get into the what and the how. We're going to explore what a penile prosthesis actually is and the different ways it can work.
So a penile prosthesis, or PP for short, is a medical device that's surgically placed so it's entirely inside the body. And that term you see right there, gold standard, that's not some marketing fluff. That comes directly from the medical world. After 50 years of innovation, it's widely recognized as one of the single most effective ways to restore function.
So patients really have two main options to choose from. On the one hand, you've got the Malleable device. It's simpler, it's super reliable, and it's a great choice for anyone with limited hand dexterity. The biggest trade-off, though, is that it's always firm, which, can make concealing it a bit of a challenge. Then, on the other hand, we have the inflatable implant, and this is by far the most common choice. We're talking over 96% of the time. It uses a little hidden pump to create an erection that looks and feels way more natural. And, critically, it allows the penis to go back to being completely soft when it's not in use.
Now, this isn't just a clinical decision, right? It's a deeply, deeply personal one. And that's where the conversation between you and your surgeon becomes absolutely essential.
The big takeaway here is that this is a partnership. It's not the doctor telling you what to do. Choosing the right implant is a shared decision. Your needs, your lifestyle, maybe your partner's perspective, and of course, your surgeon's expertise. It all comes together to figure out the best path forward for you.
I love this quote from the source material. It's really the philosophy that the best surgeons live by. You see, managing expectations is the absolute key to being happy with the outcome. And that means having a totally open, honest conversation about everything, especially things like potential changes in penile length, just to make sure that the final result is exactly what you were hoping for. And this slide basically maps out what that critical conversation needs to cover. A great surgeon is going to walk you through every single one of these points. The risk of infection, what to expect with pain after surgery, any possible changes in size, how long the device will last, and any potential impact on sensation. Covering all this ground is what ensures you're making a fully informed decision.
Okay, so the decision's been made. You're moving forward. What does that path to surgery actually look like? Let's walk through the key steps.
A successful outcome doesn't just happen in the OR. It starts way before that. This checklist just shows how meticulous the prep work is. Surgeons make sure that any chronic conditions, like diabetes, are totally under control to help with healing. They screen for any infections that could cause problems. They even pre-plan the exact placement of all the device's internal parts and work with you to create a personalized pain management plan.
So once it's time for the surgery, surgeons usually have two common ways to approach it. The penoscrotal approach uses an incision on the scrotum, while the infrapubic one uses a little incision just above the penis. And as you can see, they each have their own pros and cons. But what's really important to know is that the research shows both methods end up with really similar satisfaction and infection rates. The final choice usually just comes down to the surgeon's expertise and the patient's own anatomy.
Look, a huge concern for any kind of implant surgery is, of course, infection. And the modern techniques to prevent it are incredibly advanced. We're talking about devices that are actually coated in antibiotics, powerful skin preps, and super strict protocols in the operating room to keep that risk as low as humanly possible.
And now, for the part I'm sure everybody wants to know about. What is life actually like after you've recovered? Well, honestly, the data is pretty remarkable.
I mean, just look at these numbers. They really speak for themselves. A massive European study found satisfaction rates hitting 98% for patients and 96% for their partners. Those are incredible numbers, and they really highlight how restoring this function has a profound impact not just on the person, but on the whole relationship. This is where all that careful prep work and shared decision-making we talked about really pays off.
And what about reliability? You might be wondering, okay, but how long do these things actually last? Well, these are not temporary fixes. A major analysis showed that for modern implants, over 75%, 3/4 of them are still working perfectly at the 10-year mark. These things are absolutely built to last.
And this graph really brings that durability to life. So on the side, you have the survival probability of the device, and along the bottom is time in years. Each of those lines is a different model. And you can see how the top lines, which represent the modern implants, they stay super high, well past the decade. It just reinforces how incredibly reliable the solution has become.
And the benefits go so much deeper than just the physical side of things. The ability to restore this part of your life is profoundly psychological. Research has actually shown a significant drop in symptoms of depression after a successful procedure. This isn't just about restoring erections, it's about reclaiming a sense of wholeness and well-being. So this all brings us to one final powerful thought. When you look at the sky-high satisfaction rates, the long-term durability, and the huge psychological benefits, it really makes you ask the question, is the real power of this procedure not just about restoring function, but about restoring confidence? For so many men and their partners, the answer to that is a resounding yes. Thanks for tuning in.